Bismillahirrahmanirrahim. Should I start?
Yes, you can.
Bismillahirrahmanirrahim. In the name of Allah, the most beneficent, the merciful. Today on this program, we have with us Dr. Anjum Khan. Before I introduce her, let us just get an idea why we are doing this program, because health today is the most important thing, and there are many aspects of health. Every part of the body is precious, and every part of the body needs special attention. And for that purpose, we need to concentrate on those parts of the body too, those instruments in our body too that help us to maintain our digestive system, that help us to maintain our strength, our energy. And the first part where the digestive system starts, that means we need food for energy, and the digestive system starts with your mouth. And with the mouth, in the mouth, it's our tooth that helps us to chew the food. If there are no tooth and we don't have teeth, if our teeth are not strong enough, we lack on many of the foods which we cannot eat or enjoy. And that takes us towards towards something that is called as depression. Many young people too, because of the structure of their tooth, they are not very confident of themselves. So we are doing this program so that the moms get a chance to train their kids and to develop them wholly, like in all aspects. So today, if you have any questions about the teeth of your children, any problems that specifically your children are facing, you can put your questions on our YouTube comment box, and then we will make sure that we put your questions in our program. So here we start today. Our special guest is Dr. Anjum Khan. She's a dental surgeon from Mumbai University and has trained in dental implants. Her remarkable explanatory and practical skills have endured her to several patients across the globe. She is a fellow of the International Congress of Oral Implantologists. She is skilled in treating patients of all age groups. So welcome to our program, Dr. Anjum.
Nice to be on your show.
We are so glad to have you here. So how you doing?
This is quite informative to especially the mothers to understand when exactly they should take their child for the first dental appointment, because I think that's the first thing which comes to my mind, and that's the first question my mother's patient asked, the grandmothers asked, all age group is, when is the first dental visit? And I think this session, as if you would like to give me questions, I'd like to answer, or as you would want it, I'll be happy to answer any queries which you all have.
Yeah, thank you so much for this approach, Dr. Anjum. So the first, I have some questions here that my audiences would like to hear from you. First thing is that how does the natural denture affect the person's personality? It is such an important question, that how does the structure of your dental, like the teeth coming up or something in your mouth, does that actually affect the personality of a person? Does that have the effect on especially the kiddos, especially the young ones, the teenagers? Does that, do you think that it affects the teenagers or a personality as a whole?
Yes, it does. What exactly happens is, like, we are governed by a lot by our genetic factors, the shape of the teeth, the texture of the teeth, and even the positioning is mostly genetic. Apart from that, even early thumb sucking, lip sucking, or when you give these pacifiers not approved by the American Dental Association, the typical ones which cause the lips to collapse. So all this is very important, but I feel yes, especially even from the childhood, if a little cavity is there on the front teeth, the little toddler, I wouldn't say even a school going toddler would get conscious. Then as the girl grows up, a little buck teeth can bring them, they are not confident talking, their smile line. So things have changed over a period of time. So the main thing I would suggest is the early identification, to take your child to the dentist. The first visit should be something around 1 year to 14 months, because even at that age, even small cavities, when they start going to preschool, the mother is anxious. Then there is a link between your dentist and your child from the growing years. They study whether the jaw size is enough, the teeth size is enough. So it's a long association, I would say.
Okay, so you mean to say that the early development of the tooth is actually what affects the personality of an adult?
Yes.
Yeah.
Yes.
So very important, mothers, that you concentrate on the early development of the tooth rather than looking at it at the teenage. We start with the early age. Very, very nice reply. So as you said that we should start at a tender age. So suppose if my child is 10-year old and I haven't visited a dentist yet, and I feel proud that I have been taking care of my child's tooth such well that till 10 years and 11 years, I did not have to visit the dentist even once. Is this approach right?
No, this approach is not right. You have to have a first dental appointment, like a friendly dental appointment. Never take your child to a dentist in an emergency, because that mars he'll see the doctors with all their equipment and the drills. And of course, with this COVID-19, so I think all dentists look like from outer space wearing the PPEs. So in this COVID areas also, you should actually introduce the dentist to somebody to say to look after your teeth. And of course, a general dentist with good experience or directly a specialized periodontist would be able to take all the anxiety the parents have and even help the little one.
Okay, so do we have special dentists for the kids?
Yes. In some areas, periodontia is a part of dentistry which deals with only looking after kid patients. They are trained in that. Then, once he handles the kids till about 11 to 12 years of age, if the child requires orthodontic treatment, he allows the child or refers the child to an orthodontist.
Okay, so there are special, usually, when we look at dentist, we see that it is a dentist. We do not think him thinks in a way that this would be a pediatric dentist, though the parents are becoming aware day by day. But usually we take them to any doctor and then we just grab a painkiller and we think that the purposes suffice. Saying that, what about the milk tooth? Does the milk tooth is very important to maintain, or can we just not worry until that age? Like when the milk tooth, if I have seen many kids who have a decay in the milk tooth itself. So do we need to actually worry when the milk tooth gets decayed because it anyway is going to fall?
No, no. See, what happens, the first tooth which the baby cuts is when the baby, he or she, is about 6 months old. That time you will find the lower two incisors rupture and come out. Then it's a sequence, it's the upper teeth. Then will be the lower baby molars, then the upper baby molars, then the canines. So this is a period which starts at the time of 6 months, and by the time the child is 14 months, all his baby teeth are in his mouth. Now the best way to avoid any cavity on these teeth is firstly the not to give a feeding bottle milk at the time of sleeping. That is a big no in dentistry. And even when the child starts his soft diet, of course, you have these good brushes, 2 layers of rows. The mother has to do it. You cannot handle the toothbrush and give it to the kid and put a blob of paste on it and say brush. The mother should be brushing it. Paste, yes, sometimes required, depends on which county you all are staying, whether it's fluoridated water or this. But usually in India, we have, I think, very mild fluoridated paste. But I think the best with experience is even a good sterilized piece of gauze. Even after soft diets at about 8 to 10 months, when the mother starts, she should wipe down the incisors, the molars with these soft sterilized gauze pads. Nothing sticky should stay on the tooth. It's not that cavity like sugary foods give cavity. Anything staying on the pristine enamel for a long time causes acid attack, which makes little pits, which are precursors to your cavities.
Okay, so here is an alarm for the mothers. Usually, when our kids are small, we do not care about their cleaning their mouth. So at least keep a cloth, because when the kids start toothing, at least keep a small muslin cloth, and then you can just
wipe it down. Plus, you have to keep on checking for any small black dots. Then that's what I said, when the child is about 12 to 14 months, a friendly visit. If one of the family members is going, so the child is accustomed, said, oh, this doctor just looks into the mouth, he only counts the teeth. Then there is familiarity. Then the kid will be happy to sit, because every time the dentist in an emergency shouldn't be like someone who will give him pain. Then they will use terminology like, this is a washing machine, we have a water jet, we brush your teeth, and that's it. Because the baby are a precursor, they'll give the path to the permanent teeth. Like the baby premolars will fall and the permanent premolars come. So that has to be a good link. A family dentist, you needn't run to the first periodontist, but a good family dentist could introduce himself and then take it from there.
Yes. Okay, so the 12 to 15 months, 15 to 18 months, at least when your child is 2 years minimum, I would say that at least when your child is 2 years, it's very important that you visit the dentist, so that any problem with the jaw, any problem in the teeth, that's not visible, because teeth is something where the pain wouldn't arise with the first depression formed. It is going to take time for the pain to pop up.
Yes. Yes.
Yeah. So
pain only comes once the cavity goes deep into the third layer. That's the core of the tooth.
Yes. So before the pain arises, visit the dentist. Okay. Now, my next question here is, when should we expect the tooth fairy to visit our kids? We visit the dentist. Now we have this myth, that the tooth fairy comes and takes our tooth. So the kids are waiting. Okay, the tooth fairy is going to take the tooth and give me $1. So do you think what should be the expected age that the first milk tooth falls?
First milk tooth falls when the child is around 5.5 to 6 years. This all depends from child to child, the milestones. So the first teeth to fall are the lower front baby teeth. You will see small like pearl-like on that in the inner surface sometimes. Sometimes the permanent teeth already come and the front teeth, baby teeth have not fallen. At that stage, the mother has to take the kid to the dentist, because he'll facilitate the eruption of the permanent. So the first tooth falls at the age of 5.5 to 6 years.
Okay, that's 5.5 to.
And the permanent.
So 5.5. Okay, the virtual conversation is quite a bit tricky, because we don't know if the person has stopped. And okay, so here you go, that we expect the teeth to fall at the age of 5.5 to 6. And if there is any overlapping, please take your children to the doctor. And the next question that we have here is, does falling off milk tooth affect the health of the child? Like there is a myth, or might be reality, that when the teething starts, when the child starts getting the tooth, he might face some health issues, like some kids face diarrhea, while some kids, this is what I as a mother have experienced, and that is what I was told about, that might be the child gets fever, this kind of symptoms when he's getting teeth, when the teething starts. So does even falling of teeth comes with such symptoms?
Yes. See, eruption also, basically, what is a baby tooth eruption at the time of 6 months? Also, many mothers feel, it itches. The gum first swells up, and it itches. So it's literally a tear in the gum to allow the baby teeth to come out. So yes, what happens is the child likes to bite. That's why we say give a teeth, a rusk. So it facilitates it. Because the myth is there, the child gets an upset tummy is because he puts everything in his mouth. That's the reason. But mild fever and itching of the gums, you'll find the child keeps on rubbing his gums. So this is the signal that its baby teeth are coming. The same thing happens for exfoliation. Of course, by that time, the child is 6 years old. So he'll automatically tell you this tooth is shaking. And then it just falls off like a flower bud. There may not be any bleeding, nothing. The gum just closes and the new tooth is there ready to come behind it.
Okay, so already the tooth is present. Gums are just waiting so that the tooth erupts and it pushes the other thing out. Okay, so
it acts like a pathway. The baby tooth gives direction to the permanent to follow its place.
Okay. That's the nature is so wise. It has made things so such intricate things to be noticed when the tooth is coming out. Such beauty. Okay, so as we understand now that the tooth are already present, eruption of gums, the tearing of gums is what causes the health issues. Now, if such health issues are caused, like if the child is facing stomach issues, or if the child is facing fever, or upset, the child is not in a good mood, is there a home remedy for that, or are there medicines prescribed for it?
I would just suggest we usually here give plain paracetamol. Here locally we get a good gel. It's called Zyte gel. It's nothing but glycerine with a little local anesthetic, very mild palliative. So it just benumbs that little. Usually we advise the mothers to take a little on the fingertip and rub it. It's called Zyte gel. I don't know what's available there for y'all, but it really works wonders. And plain paracetamol, just half a teaspoon, and the child is fine. A lot of rusks, bread sticks, soup sticks is good because when they gnaw on it, it facilitates the eruption and takes away the itching from the gums.
Mm-hmm. Okay, so Dr. Anjum, here comes the next question. The next question is, we have a food for every organ of the body. Like people say that, having walnuts is good for your brain because it's of the shape of the brain. Some foods like coriander, they say so. I'm not saying that this is, but I'm just giving you an example that we say that the coriander is good for your kidneys. And there are such foods for your gut and for every organ of the body that, even especially in this COVID-19 scenario, people are suggesting so many foods for different parts of the body, so many ways of taking in those foods. So here comes up the question that every mother is having, that are there any foods that strengthen the teeth? Is the teeth also affected by certain kinds of food that enter our body, or is it just affected by brushing, and is it only maintained by just the oral thing?
See, the formation starts much, much earlier in the fetus. The outline of the enamel, the dentine, all has started. So it's basically for the baby teeth, it's what the mother has had during the first 3 months of her pregnancy. Regarding the permanent teeth, yes, it's as the child grows up, a good balanced diet. Milk is very important, and I think breastfeeding milk is the best available. But of course, once the child gets a little older, and when you would like to add, cheese is a very good snack. I would suggest, it's even been proved to be anti-carious. A little nibble of cheese mid-morning for your toddlers and your school-going little kids having is very good for, it's anti-carious. Otherwise, a good balanced diet, calcium, milk in any form is very good.
Okay, so milk is the best form of food. So just in case some mothers these days are not able to do breastfeeding for some reason, so is there a specific milk like cow's milk, goat milk, powdered milk, or any other thing that?
I think the pediatrician will help the mothers to decide. But calcium, I think milk is the best, beautifully absorbed for the growth of the permanent teeth. Because like I said, the primary teeth, the baby teeth have already started their formation when the child was in the fetus. So that is
Okay.
on the mother's good diet in the first 3 months, good calcium, good milk. She can even have a little piece of cheese, which is high protein and good in calcium.
Yes. So that's a nice piece of information that the teeth of your child are not just developed when your child is in your arms, but it starts in your
Fetus when
womb. So we have to be very careful. Yes. So we have to take care that we are from that time itself, we are taking good calcium. Maybe that is the reason why the doctors insist on calcium supplements when the woman is
yes.
pregnant. So speaking of calcium supplements, if suppose for some reason the child is not taking the good quantity of milk, so do we need to provide the child with some kind of calcium supplements? Is it recommendable?
Recommend across the counter for kids. The pediatrician will probably, judge and give the supplements if needed. Here we usually don't give anything, it's just the milk. But I think abroad you all have a lot of these calcium chewies and everything. You all should give it only after discussion with your physicians.
Okay. So apart from the foods, is there anything else that causes tooth decay? Especially the milk tooth, because the parents are really worried when the young ones have teeth issues because they stop eating and they're not able to speak. Then it delays their speech. So what causes the tooth decay of young ones, like the milk tooth? What causes the milk tooth to
See,
decay?
that is what I said. If you do not monitor, see, some mothers have the habit, kids, the last feed is a sugary bottle feed. The baby sleeps with that bottle. The milk, sweetened milk, pools in the mouth. The absorption, the saliva is less. So this film of sweetened milk on the enamel could cause decay. Then the baby molars, though they are a little flat surface, something staying there overnight. The last meal after that, the mother has to brush the teeth and then has to put the little one to sleep. Anything staying on the food on the tooth surface unhindered for long time can cause caries activity.
Okay, so if any food is left on the tooth for a particular period of time, then you can expect that part of the tooth to decay. Yes. Now there is one more question coming up. What are buck teeth and how are they caused? Are they caused by any habit or is it hereditary?
See, buck teeth, I would say, see, this is the terminology which was used. What happens is at the age of 6.5, 7 years, the child is in the first growth phase pattern. So at that time, these facial bones are also growing, and at the same time, the eruption of the tooth is there. So baby teeth are small in size. The permanent teeth are big. So what happens is the spacing is not enough. These protrude out. The first appearance of the teeth shouldn't alarm the mother to run to the dentist to say, my child has buck teeth. But she should, of course, see it over the next couple of months how the upper lateral incisors come in position. Then the canines come and bring this part into growth pattern. So buck teeth, I would say, is anybody could, even I would have had buck teeth at that age, which we call 6.5, 7, 8, because those two are two big teeth adjacent to two small baby teeth. So a good, like I said, the introduction of the, again, I repeatedly say, the parents taking a friendly visit to the dentist makes things easier, so that sometimes the dentist can say every 6 months bring the child. So he monitors the eruption pattern and the exfoliation pattern of the teeth to give more confidence and avoid this buck teeth or overlapping of teeth growth pattern.
Okay, so when we see the overlapping of teeth, so at what age do the dentist actually remove the teeth that is not required? Say So when actually what I understood is that the buck teeth, when we see two teeth coming at the same point of jaw, it doesn't mean that the two teeth are coming together. It's just the previous milk tooth that was already existing, and this is the new one that just popped up to show that I'm better than you. So when this two teeth are at the same place, so what does the dentist do to make this a better pattern?
Yeah, so what the dentist would do is, now the dentist will say, oh, so the baby teeth haven't fallen and the permanent have come. Then he'll probably apply a little numbing gel, and he'll probably first take a little radiograph to see the different teeth in all. They usually like to do an x-ray of the jaw, or they do small digital x-rays of the full mouth. So they know each tooth where the permanent is. Then probably he'll do a little numbing lotion and remove these baby teeth to facilitate the tongue to push the permanent teeth in the arch form. Now, this is a sign that the child will probably need to visit a dentist every 3 to 4 months to prevent this episode. Now, this shouldn't become a habit. The permanent teeth come, the baby teeth have not fallen. So every time, probably now that sometimes the dentist predicts it, and he says, oh, so now this is ready to come, but this baby tooth has not fallen. So he does what is called elective extractions of these teeth, selective extractions, to facilitate the permanent teeth to come in a better position, rather than let everything go havoc and say, oh, everything come in wrong position, now I will straighten them. So that is not done. So he'll probably do elective extractions to facilitate the permanent tooth eruption.
All right. Okay. So the dentist has something to do. So whenever we see such buck teeth, we should visit the dentist. That's the best way to take care of it. Okay. And is there a way to avoid this, like some pattern of brushing, or maybe some kind of a massage, or something that could avoid this, or is it only a visit to the dentist?
No, only visit to the dentist.
Okay. Fine. Now there are many myths that come up with the dental issues. So one of them is that if we remove the teeth at early age, or in fact, I have heard this for every age, if you extract a tooth, and especially if you extract the molars, and if it is at an early age, it causes the weakening of the brain. How true is this?
It's not. It's a myth. This has no link whatsoever to that. This is nothing. If a tooth is infected, be it a baby tooth, the concept is not to extract it. Like I said earlier, we have to keep it in the mouth. Even a very badly carious baby tooth can be restored by doing something called a baby root canal, because the baby molars erupt when I said the child is about 12 to 14 months, and they have to be in position till the child is 11 years. So if the tooth has a cavity, it has to be restored. They restore it, do a baby root canal. It's a single sitting appointment. And then they restore it with a small stainless steel crown. So it becomes like a full tooth. And when the permanent tooth is ready to come, this will fall off with the crown. So it doesn't hamper or avoid the eruption of the permanent teeth. But we have to save it to preserve the permanent tooth.
Okay, so the reason why this myth arose is because of the root canal treatment. The root canal is such a scary thing. It not only it scares the heart of the mother, it just scares something out of you, because the so many drillings and so many injections going into the mouth of your child, even the thought of it is so scary. Is it that painful to do a root canal treatment, and how safe is a root canal treatment? Does it have a side effect?
It is a very safe procedure in good hands, with the good hands of a periodontist. And once the child has confidence in the doctor, then you won't believe it how happily they sit. They understand the terminology. Tell them, oh, this is like a washing machine. This is like a suction. We need to clean the little cavities in it. We need to clean the little cavities and the black spots there. And once the tooth is benumb, that is, of course, the expertise of the periodontist. He'll benumb the tooth is numb. Then we say, oh, the tooth has gone to sleep. The child allows. It's a very short procedure. And it's done. And once it is done, yes, that evening the child may be a little numb on the side where the doctor has worked. Soft diet, a course of antibiotics, and by next morning the child is back to normal and doesn't even. I think we all as mothers are more anxious rather than, and our anxiety is seen by the child, which makes them nervous. That's the main thing. So I think we should have confidence in our doctor that she will or he will handle. And once they build up the rapport, I've had kids who just sit through the procedure. The dentist tell them little stories, gives them little squeezies in their hand to play with, and they do perfectly well.
Okay.
Just
So
get
the
the confidence of the child. Once the child is your best friend, once they get your confidence, you won't believe, Sabika, how they sit quietly and they'll allow you to do everything.
Yes, I have that experience. I've seen that because more than the child, the parents are so scared. Their hands are going cold because something is going into their child's mouth, and it's a drill machine. So
Yes.
it's so scary. I can very well relate to that.
We all are bad mothers, don't worry.
Yeah, in some matters, and we are trying to be good, and that's why we are conducting this program, right? Yeah. Okay. So there is one question that's popped up. Does extracting of tooth causes blindness or impair of vision? Because we usually hear that these nerves are connected, the facial nerves are connected. So that brings us to, we are all smart and science loving people. So we think that the tooth nerves are connected to our ears, our eyes. So does it cause any kind of? That's what I was asking. Does it cause removal of a tooth or a treatment of the tooth? Does it cause any kind of impaired vision or hearing effects or anything?
No, there's no link to that. It's very specific. For every tooth extraction, that specific nerve ending is benumbed, and it's a very simple, easy technique for an extraction. Nothing like that happens.
Okay, so just be rest assured, mothers, because nothing is going to happen to your child or to the brain or the eyes or the ears or any part of the body. Just go and instead of keeping the child in pain.
Yes.
Let the child relieve that pain, have good food, stay healthy. Okay, now speaking of food, the next question here coming up is, does the junk food affect the tooth?
Yes.
How does the junk food affect the tooth? Like, is does it affect only when it stays on the tooth? Like, if we are eating chips or chocolates or any kind of junk food and we brush our teeth nicely, is that enough, or does the junk food still have effects on your oral structure?
Junk food, see, I would say good 3 time meal, but it's difficult to get these kids to do that. Like I said, snacking in between, if they have a habit, they can do. Your cheese is good. Of course, this is now for the teenagers. Chewing on sugar free gum is a good rag picker. Half an hour chewing sugar free gum acts like a rag picker, picks up everything on the on the chewing surface and keeps it clean. Because everybody, otherwise the age old Indian method where you, after you eat your meals, a good gargle where you swish the water and like a little flush it all out. But in some places when the kids say, oh, we can't, then if they pop in and chew a sugar free gum for half an hour, it can act like a rag picker. Eating junk food, yes. What I would say, you munch into a burger, a french fry, a smoothie, not rinsing your mouth. It stays there till your dinner time. You top it up with dinner time. You don't brush. So this is a vicious circle. Like I repeatedly say, the tooth surface should be sparkling clean, and for that even good amount of drinking water, sipping water after every meal, all these things is basically to act like a flushant.
So we need to have healthy foods as it is. It's not advisable to give these junk foods. We might have one session only on junk foods with different doctors who deal with this, a pediatrician maybe, who can guide us about the foods. Now, doctor, there are some personal questions coming up. Here is a question that my daughter has got a teeth 1 year back, but it doesn't grow. Like when she was 6 years old, she got this front tooth, but it is good. It seems to be in the growing procedure because both the tooths have not become equal. So is it something to worry about?
Yeah, you should visit your dentist. Like I said, they'll do an X-ray to see, is it, sometimes there may be a thick band of gum tissue which will prevent it to come down. First, they'll study through the radiograph. Is there any hindrance? Mostly what you've mentioned, sometimes in some kids, the gum is very thick. So it doesn't allow the normal tearing procedure. Then the doctor will facilitate that. So yes, the child should be taken to the dentist.
Okay, so yes, and one more thing, doctor, that how long does it take for the teeth to grow? How long should we expect? 2 months, 3 months, or can it prolong in some children?
It depends from child to child. I have seen kids which have lost their front upper teeth when they are about 6. Until 7 years, we can see the bulge, literally like two bulging tissue, but they wouldn't come out. So we waited for some time, and then we had to do a little procedure where, under local anesthetic, we just nick the little gum line, and within 15 days, the teeth make an appearance. So sometime it all depends. The dentist will take the decision.
Okay, so it might take longer. It might
Yes.
take longer. That's what about. Okay, it might take longer for the teeth to come out. So need not worry. So we need not run to the dentist if within 3 months our tooth are not seen coming back.
Yes.
So, but your periodic visits to the dentist is what is advisable the most. Coming to one of the questions that pops up here, when we this is from the oncology department. It's someone is asking that, does teeth too have cancers, and what are the signs of it?
Teeth per se can't have cancer. It's the adjoining tissue. It could be cancer of the gums, of the bone, which causes and affects the teeth to fall off, because they, per se, it's only hard, solid calcium. So what will happen is, if God forbid they have a cancer of the jaw, so it eats into the bone. So these teeth will be there in the mouth, but when a radiograph is taken, they look as if they are floating because there is no bone support. Teeth will never get cancer. Teeth can only get decay.
Okay, so the teeth can only get a decay. There is no such thing called as the tooth cancer, but there could be in the tissue
Or the gum, which will cause them to just fall on their own. Or even if they are firm, they look firm, but when a radiograph is taken, we call that typical floating teeth appearance. There's just nothing beneath that. It's just the tooth there, like in a black film.
Okay,
Coming
coming to the Indian scenario, especially and helping our audiences who are mostly from Chennai, do you think that we notice this, that it's very expensive to visit a dentist? Not denying the fact that it's becoming a trend that richer the person, the better the tooth. So, do you think there are cheaper options, or are there recommended hospitals where people can take kids for a regular dental visit, or what could be the cheaper option of that? Are there government hospitals who conduct dental visits for kids?
Yeah, see, I wouldn't know how it is here, but usually these government colleges do have pediatric departments. So they have the HODs, and I think if you take an appointment, the head of the department or the senior lecturers or somebody do clinical work. But it's a myth, Sabika. I only feel it's the, of course, yes, circumstances do say it's expensive visiting a dentist, but at the end of the day, see, the more you delay it, especially we have kids, they are buck teeth, like we talked about earlier. We don't take them at that young age. When the girl is 15, 16, the teeth are all in a bad position, and then that time, the doctor is going to, I wish you all had come earlier. We could have done some elective extractions and caused these eruptions to come in normal pattern. But now it has become a trend, rather than going at a later date. That's why I said, by the time, every family should have a family dentist who then can take you around and decide where and how the treatment can be done, rather than wait when it's too late and it's just an emergency, you have to go.
Okay, but there is a very different question coming up. Someone's asking that, can you tell us, estimate how much it costs to take my child to a dentist? I know this won't be a question to
So
the
it is,
doc.
I'll tell you one thing, things were very different. Now we have to define dentistry in two eras, Sabika. It's pre-COVID and post-COVID. Things were much, much better. We could, but now seeing the conditions, every dentist is, of course, being on the first front line. They have to do all this PPE and the sterilization and working with these aerosols. So yes, in this time and era, to visit a dentist, it is going to be expensive, because every dental clinic, be it a one chair or a multi chair, have to do the extra charges to overcome all these extra expenses, and to keep protective gear for themselves, for the patient, for the environment. So it's very difficult for me to now sit and say, but yes, you have to at some stage. Things we are only saying that at least once this tapered on, but this is the way the dentists work now in this era, is going to be a little different from what we were doing earlier.
Okay, till now we have been speaking of the dental health of the child. Coming to the dental health of the mother, how long can we delay the visit to a doctor after seeing a depression in my tooth?
After,
After seeing a depression, after seeing a small cavity or a small black mark on my tooth, how long can I delay? How quickly does that decay grow, and how quickly does that affect the adult tooth?
now see, the moment you see a black spot, see, every black spot is not a decay. So that's what I said. Don't wait for it. See, because by the time the pain comes, means the cavity has crossed the enamel, has crossed the dentine, and reached the heart of the tooth, which is the pulp. That's when it is painful. So a small cavity, like now coming to the expense, it's cheaper to put a simple filling rather than to deal with a root canal or crown. And if suppose it is even not treatable there, then the only option is extraction. So I would suggest you should have, apart from everything else, once 6 month dental visit is mandatory. So they, by the time we detect a cavity, it is a small thing, but when the patient comes, it's already big. So then the bigger the cavity, the bigger the treatment, and the more expensive it is.
Yes, truly said. Earlier, the better, because if the smaller the cause, the smaller would be the treatment, and smaller would be your expense.
Yes.
Coming quickly, taking our conversation ahead, I would like to ask about the dental implants. These days, there are bridges installed and things to facilitate the tooth. How effective are these implants? Like, you are putting some kind of a screw thing in your teeth and then putting the teeth, and when we were sitting at your clinic, we just saw that everything on happening on the screen. So that puts us into a question that after doing the dental implants, after getting our tooth bridged and everything, how long do I expect that now it is not going to trouble me? How long does that stay good?
I'll tell you one thing. Even after a bridge or crown is placed by a dentist, Sabika, dental visits, see, even that needs maintenance. It's not that your doctor has placed a bridge. Okay, I'll explain. A bridge is placed when one tooth is missing. So they shape the adjacent two teeth, they cover them up and link it with the missing on. So it's a 3 unit bridge for one tooth. So of course that also needs maintenance. The dentist will teach you how to place the bridge, how to place the crown, how to place the implants.
Okay, I think Dr. Anjum for some reason is got disconnected. Until Dr. Anjum gets connected, let me just tell the new the people who have just started viewing our program that we were just discussing about the tooth problems of the kids, and we had a really good conversation, because at a very early age we do not realize, because the child is always playing, the child is always into his own world, and he doesn't have time to sit and tell you that I have pain in my tooth. So that little pricking sensation that our child would not be able to tell us until it grows into a very big pain, a swelling is seen, and then we realize that, oh, okay, something is there, some problem exists in my child's tooth. So that is the reason why we would get that is the reason why the Dr. Anjum has suggested us that take regular visits to the dentist, so that you could know what's happening actually to your child's body. And it's not just about the dentist. Regular visit to a doctor doctor. There is a myth that if we go to the doctor, we'll come back with a disease. No, it's not so. Let us trust the doctors. Take your children to the regular visits to the doctor just for a general checkup, and let us see how our child is growing. And it's very important, because the child one day would come up and ask, what have you done for me? Where are the records? So we need to have records for our kids, so that at any point of time, if they need, what happened to them, like when we go to the doctor, sometimes the doctor would ask us even about our birth. Was it a normal birth or was it a cesarean? They would ask us even that question. So it does matter. Every stage of the life matters, and we have to take care of ourselves at every stage of the life. I'm very sorry that our speaker, Dr. Anjum, is not here, but I'm very thankful to her that she was on our show. And she has given us such nice tips about brushing the teeth, about taking care of our teeth, about the dental implants, about the dental structures and everything. Mostly all the questions that she covered were very important. And it was boon to the mothers having her on our show. So thank you, Dr. Anjum, so much if you're viewing us. Thank you so much for joining us. Thank you so much for giving us your time. And it would be great if you want Dr. Anjum to come back to our show, and if you still have questions, then please leave a comment, and we will see to it that Dr. Anjum is back to our show for a second round. Thank you so much for joining us on our program. It was glad having you here, and may Allah hasten the reappearance of Imam Zaman alayhi salam. Thank you so much for joining.